Alright, let's check in and see what's going on, Benjamin.
Okay.
Alright, we got a shorter imbalance over here on this leg.
What does that mean?
That means that your pelvis on here has a subluxation. And this hip right in this joint right in there, you can feel that, all tender and locked up. So it's locked up and it's not moving. By the way, you're on video camera. Hi everybody, my name is Dr. Ben Shamoiel, the LA Chiropractor here in Century City. We don't let our patients know that we're videotaping them, just kidding. Richard's been here. Richard works across the street and he sits all the time. I know, it's okay, sorry. So he sits all the time and he's also a wonderful jazz drummer, okay? So not only does he like to be in the office during the daytime, at nighttime he is playing somewhere around town. So he's doing a lot of sitting, a lot of stress in this low back area. So what we did in our orthopedic test, we noticed that this hip right here is not moving the way it needs to move. This one moved very nice and fluid. This one moved very, like it almost stepped like a little bit at a time. So we want to make sure that it is moving, not only functionally. This is going to reduce any hip issues here, reduce knee and ankle issues. So you can see on this poster right down into the low back the amount of nerves that are there. So not only is it affecting the hip, it affects the prostate in men, digestive system, bladders, reproductive. Everything is affected by the subluxation here in the pelvis. So what we're going to do today, really easy adjustment. I like blocks. Blocks help me. I can see the torque. One hip is higher than the other, so I'm going to put these blocks under the pelvis. I'm going to ask Richard to take some nice deep breaths for me all the way down. I'm going to grab my arthro stem and very rigid spine. You know, we need to have that flexibility. So when I have patients with very rigid spine, I want to induce some motion in there. We usually do it with our arthro stem. I'm going to come around, I'm going to grab that, and I'll show you to you how that works. We use the arthro stem in here to break down the adhesions. So the jackhammer. This allows the lumbar spine to become more pliable and move. Now, this also helps release dopamine, which is in the spine. That's why when you work out, you exercise and you're moving, you feel good because your spine is releasing a lot of the good hormones and chemicals. And here on Richard, I'm going to go through his whole spine. I'm going to focus on putting a lot of the thoracic spine. A lot of the drummers that we have are just like people working at the office. Now he's doing double duty. Not only is he behind the computer, he's on the drums. So we want to make sure his whole spine is fluid and moving. And don't forget, the subluxation is the area that's putting stress on the spinal cord. Any kind of stress on the spinal cord is going to reduce the body's ability to heal itself and function properly. So he likes to function, he wants to perform, and our goal together is to keep him moving, keep him performing, reduce a lot of the discomfort that he's had, and clear up his nerve system so his body can function properly. I'm going to do a couple of drops on this table. Good, nice and easy. We can see where the pelvis is in the sacrum. Good. One more. Good. Nice one. Good. That's pretty much all the time it took for the pelvis. We're going to post check to make sure the legs are balanced. Go ahead and bend that knee for me. Great, nice and even. You can see the heels line up nice and straight. So when we had a deficiency on this side or stress on that right leg, now we can see that they're balanced. So this is the way we address low back discomfort. Later, if this had continued, these would cause the pins and needles in the foot, pins and needles in the leg, the stiffness, the achiness. So you can see how much density there is into that low back area of the sacral spine and the nerve system. So we want to make sure that the low back is clear. And again, sitting for 30, 40, 50, 60 hours a week does not help that out. I want to thank you guys for joining me. I'm going to put more of these educational videos. That's how we address the low back discomfort, the low back subluxation. And we've got some great results. Thanks for joining me. Subscribe, and I'll talk to you later.